Welcome back our fans. 3. Parathyroid gland. The 4 parathyroid glands lie behind the lobes of the thyroid. They secrete parathyroid hormone, PTH. Together with active vitamin D3, PTH keeps the serum calcium level stable, 911 mg/dl. Parathyroid hormone, PTH, regulation. 1. Low serum ionized calcium stimulates PTH secretion, while high serum ionized calcium suppresses PTH secretion. 2. The active form of vitamin D3 suppresses PTH synthesis. Normally, PTH increases serum calcium levels by acting on 1. Bones, stimulates osteoclastic activity. 2. Intestine, increases calcium absorption. 3. Kidney, increases calcium reabsorption back to the bloodstream instead of losing it in urine, plus activates vitamin D3, its brakes. A. Hypoparathyroidism. Etiology. 1. Surgical removal of parathyroid glands. 2. Radiation to the neck. 3. DeGeorge syndrome, a developmental abnormality of the third and fourth pharyngeal pouches. Parathyroid is underdeveloped or completely absent. General manifestations of hypoparathyroidism. Often asymptomatic. Symptoms of hypocalcemia. Neuromuscular irritability. 1. Paresthesia of hands, feet and circumoral tissues. 2. Anxiety and confusion. 3. Triggered tetany. A. Chvostek sign, tapping on the facial nerve in the preauricular region, which causes twitching of the facial muscles. B. Trousseau sign, carpopedal spasms, contracture of the hand and fingers, on restricting the blood supply to the arm with a cuff. 4. Severe tetany, muscle cramps, tonic-clonic seizures, laryngeal stridor. Oral manifestations of hypoparathyroidism. Enamel hypoplasia, predisposes to caries. Dentine dysplasia. Delayed eruption. Impacted teeth. Short roots. Hypodontia. Chronic mucocutaneous candidosis in DeGeorge and candidosis endocrinopathy syndrome. Laboratory findings. Low PTH. Low serum calcium levels. Serum phosphate is elevated. Alkaline phosphatase is normal. B. Hyperparathyroidism. Etiology. 1. Primary, due to hyperplasia or adenoma in a parathyroid gland. 2. Secondary hyperparathyroidism. PTH levels increase due to positive feedback of low serum calcium levels secondary to renal failure. 3. Tertiary, long-standing 2-Ry hyperparathyroidism may cause nonstop secretion of PTH with no response to feedback inhibition. General manifestations of hyperparathyroidism. 1. Bones. Osteopenia, lowered mass of bone. Bone pain. Pathological fracture. Brown nodes of hyperparathyroidism. 2. Stones. The high calcium levels cause excess calcium to precipitate in soft tissues, forming stones, mainly the kidney. 1. Abdominal groans. Constipation, weight loss, nausea, vomiting. Polyuria and polydipsia. Peptic ulcer. 1. Psychic moans and overtones, lethargy, depression, loss of memory, confusion. Oral manifestations of hyperparathyroidism. 1. Bones. Generalized bone rarefaction, ground glass appearance. Loss of cortical bone of the inferior mandibular border and mandibular canal. Loss of the lamina dura. Giant cell lesions, brown tumors. 2. Stones. In salivary glands, silolithiasis. In teeth pulp, pulp stones. 3. Root resorption. Laboratory findings. In patients having bone lesions, alkaline phosphatase level is elevated. In patients with 2-Ry and 3-Ry hyperparathyroidism, kidney function test. Results are abnormal. Thanks for watching. Support us by likes and subscribes.